Welcome to today's video about symptoms of hiatal hernia. What if millions of people are walking around with a condition that mimics heart attacks yet remains completely undiagnosed? Your body has been sending distress signals for months, but you've dismissed them as stress or aging. The human mind normalizes pain when it becomes routine. Psychologists call this hedonic adaptation. But what if that chest-burning, mysterious cough or drowning feeling after meals isn't normal? What if it's your body screaming about a hiatal hernia, where stomach tissue pushes through your diaphragm into your chest? Today, we're revealing 15 research-backed symptoms that could change your life, plus the exact medical tests you need to demand from your doctor to get proper diagnosis. Some symptoms will shock you. Others will finally make sense of your suffering. Most importantly, you'll learn exactly how to prove what's happening inside your body. Stay with me, because symptom 11 could be life-threatening, and the diagnostic information could save you years of medical dismissal. Please note, this video is for informational purposes only, and not a substitute for medical advice. All research is verified. References are linked in the description. All right, here are the symptoms of a hiatal hernia, starting with number 1. Heartburn. The burning sensation traveling up your chest isn't just acid reflux, it's your stomach being in the wrong place. When stomach tissue herniates through the diaphragm, it creates perfect conditions for severe reflux. The American College of Gastroenterology's 2023 research shows hiatal hernia patients experience significantly more intense heartburn than standard GERD sufferers. Psychologically, the unpredictability is devastating. Your pattern-seeking brain struggles to find triggers because anatomical disruption means acid refluxes regardless of eating habits. This unpredictability triggers anxiety responses, creating vicious cycles where stress hormones increase acid production. Studies reveal 85% of patients report their heartburn feels different, more crushing, lasting longer, mimicking heart attacks. Your mind associates eating with pain, leading to food anxiety and social withdrawal. Next, symptom 2. Regurgitation of food or liquids. Tasting dinner hours later or waking with acid burning your throat creates profound horror. Mayo Clinic's 2024 research demonstrates regurgitation occurs because hiatal hernias destroy the natural one-way valve mechanism. When your stomach relocates into your chest, gravity becomes your enemy. Psychologically, this triggers deep embarrassment and social anxiety. Humans view regurgitation as contamination, triggering disgust even in sufferers themselves. Recent studies show 72% develop eating disorders specifically to avoid public episodes. The psychological impact attacks bodily autonomy. Your brain interprets involuntary regurgitation as bodily betrayal. Patients describe feeling broken or defective, leading to depression and isolation. The cruel timing, regurgitation peaks when lying down, disrupts sleep, and creates bedtime anxiety. Next, symptom 3. Difficulty swallowing. The terrifying moment food gets stuck feels like drowning from inside. NCBI's 2021 study reveals hiatal hernias create mechanical compression, narrowing esophageal passage by up to 40%. The psychological impact runs deeper than physical obstruction. Swallowing is primitive and automatic. When it fails, it triggers primal survival fears. Your amygdala interprets swallowing difficulties as direct survival threats, flooding you with stress hormones every time you eat. This creates anticipatory anxiety, where choking fear becomes overwhelming, causing complete solid food avoidance. Research shows 68% develop clinical anxiety disorders within 6 months. Social implications devastate. Meals become battlefields, not bonding. Patients avoid restaurants and panic during public eating. Your mind views food as enemy rather than nourishment. Next, symptom 4. Chest pain. The crushing pain racing you to emergency rooms convinced you're dying, only to learn your heart is perfect. Cleveland Clinic's 2023 research reveals hiatal hernia. Chest pain often exceeds actual cardiac angina in intensity and duration. This misdiagnosis creates lasting psychological trauma and hypervigilance. Your brain, having experienced perceived death, becomes hypersensitive to chest sensations. This triggers cardiac anxiety syndrome, obsessive heartbeat monitoring and interpreting normal sensations as dangerous. Studies show 43% visit emergency rooms multiple times before proper diagnosis, accumulating trauma with each dismissive encounter. Each negative cardiac test, while medically reassuring, psychologically reinforces feeling dismissed or crazy. The eating-related pain pattern defies cardiac logic until you understand the mechanical hernia pressing against surrounding organs. Next, symptom 5. Feeling of fullness. After small meals, feeling stuffed after few bites transforms meals into frustrating puzzles. GI Motility Online's 2024 research shows herniated stomach portions create false satiety by mechanically stretching gastric receptors prematurely. Though purely anatomical, psychological ramifications are profound. Humans have deep emotional food connections rooted in survival and social bonding. When your body rebels against normal eating, it creates destabilizing cognitive dissonance. Studies reveal 79% develop anxiety around meal planning and social eating. Your brain struggles reconciling hunger with premature fullness, creating confusion in basic physiological awareness. Patients describe feeling betrayed by appetites, never knowing if they'll finish normal meals. This unpredictability triggers control issues, often leading to restrictive eating or compensatory binges during brief appetite returns. Next, symptom 6. Shortness of breath. The suffocating feeling after eating creates primal terror. Something's desperately wrong. Thoracic Surgery Clinic's 2019 research reveals large hiatal hernias compress lung capacity by up to 25%, literally stealing breath. Breathlessness' psychological impact cannot be overstated. It triggers fundamental survival fears. Your brain interprets breathing difficulty as immediate life threat, activating every alarm system. This creates cascading responses where patients develop severe eating anxiety, since meals consistently trigger breathlessness. Pulmonary studies show 61% develop exercise avoidance and agoraphobia related to activities potentially worsening breathlessness. Anxiety itself worsens breathing patterns, creating vicious cycles. Patients describe drowning on dry land or suffocating from inside. Unpredictable breathlessness creates chronic hypervigilance, with constant breathing, monitoring, and activity avoidance. Next, symptom 7. Belching or frequent burping. Uncontrollable belching isn't poor manners. It's trapped air desperately escaping. Medline Plus research shows hiatal hernias disrupt gastric emptying, causing air accumulation and forceful upward expulsion. Excessive belching psychological shame runs deep in social conditioning. From childhood, we learn burping is rude and unacceptable. When your body betrays these norms involuntarily, it creates profound embarrassment. Behavioral studies reveal 84% develop social withdrawal, avoiding public eating. Your brain associates meals with potential humiliation, triggering anticipatory anxiety that worsens gas retention. Timing is particularly cruel. Belching intensifies during quiet moments like meetings or dates. Patients feel their bodies sabotage relationships. The frequency often exceeds what can be politely excused, leading to genuine social consequences. Next, symptom 8. Bloating. Balloon-like swelling, making you look pregnant after eating salad, isn't vanity. It's gastric dysfunction with devastating consequences. Journal of Neurogastroenterology research shows hiatal hernias cause delayed emptying, leading to fermentation and gas accumulation, increasing abdominal circumference by 8 inches. Visible bloating psychological impact attacks basic self-image and confidence. In appearance-focused society, dramatic shape changes trigger deep shame. Studies reveal 73% develop body dysmorphia, avoiding form-fitting clothes and social situations. Your brain struggles reconciling normal body image with unpredictable changes. Timing is psychologically cruel. Bloating peaks during social meals or important events, making patients feel their bodies actively sabotage confidence. Many describe feeling disgusting or monstrous when bloated, leading to isolation and depression. Next, symptom 9. Nausea. Queasy feelings turning meals into stomach gambles create psychological minefields around food. UpToDate's 2023 guidelines show hiatal hernia nausea results from mechanical compression and acid irritating the vagus nerve. Chronic nausea psychological impact is severely underestimated. Nausea triggers primitive disgust responses, creating powerful aversive conditioning. Your brain associates food smells, textures, even thoughts with impending nausea threats. Appetite psychology studies show 67% develop food phobias within 1 year. Unpredictability is psychologically torturous, never knowing if today's meal will be enjoyable or nauseating. Uncertainty creates anxiety that worsens nausea through stress hormone release. Patients describe walking on eggshells with their stomachs. Social implications devastate as they avoid restaurants and dinner parties. Next, symptom 10. Vomiting blood. Seeing bright red blood in vomit transforms medical symptoms into psychological emergencies, haunting patients long after treatment. Surgical Endoscopy's 2020 research reveals severe hernias cause esophageal erosion and gastric ulceration, leading to potentially life-threatening bleeding. Hematemesis, psychological trauma, cannot be overstated. It violates basic assumptions about bodily safety and mortality. Your brain interprets blood as immediate survival threat, triggering panic responses lasting months after bleeding stops. Trauma psychology studies show 89% develop post-traumatic stress symptoms, including intrusive death thoughts and hypervigilance about stomach sensations. Visual impact is psychologically devastating. Seeing your own blood creates lasting memories, triggering anxiety and panic attacks. Patients describe feeling their bodies are trying to kill them. Next, symptom 11. Black stools. Discovering Terry. Death-smelling black stools signals internal bleeding potentially slowly killing you. NIH research confirms melena indicates significant gastrointestinal bleeding requiring immediate intervention. Psychological impact is profound because it represents invisible, ongoing blood loss, threatening life while remaining hidden from others. Your brain struggles with cognitive dissonance of feeling normal while literally bleeding internally. Anxiety studies reveal 76% develop chronic health anxiety and obsessive bowel movement monitoring. Melena smell and appearance violate basic disgust responses, creating lasting aversive memories. Patients describe feeling contaminated or rotting internally. The hidden nature creates additional burden. You can't explain terror without graphic details. Fear of sudden catastrophic bleeding creates hypervigilance dominating daily life. Next, symptom 12. Chronic cough. Persistent hacking, making people assume you're contagious, isn't respiratory. It's stomach acid burning airways from below. American Journal of Gastroenterology research shows hiatal hernia patients develop chronic cough when refluxed acid reaches larynx, creating persistent inflammation. Unexplained chronic cough psychological frustration is immense because it defies logical treatment. Your brain expects coughs responding to medicine. When nothing works, it creates profound helplessness. Respiratory psychology studies show 71% develop depression and social anxiety within 6 months. Social stigma is particularly cruel post-pandemic, where any cough triggers fear and avoidance. Patients feel like social pariahs, constantly explaining they're not sick while unable to control coughing. Timing is devastating. Coughing worsens during presentations, movies, or intimate conversations. Next, symptom 13. Hoarseness or sore throat. Raspy, damaged voice making you sound like you've been screaming isn't vocal strain. It's acid literally burning vocal cords nightly. ENT Journal's 2018 research reveals refluxed acid causes chronic laryngitis and vocal cord inflammation, permanently altering voice quality. Voice change psychological impact attacks fundamental identity and communication ability. Your voice connects intimately to personality and self-expression. When damaged, it creates profound identity confusion. Voice psychology studies demonstrate 82% develop communication anxiety and social withdrawal. Professional singers, teachers, and speakers face career-threatening implications triggering depression and occupational crisis. Gradual deterioration is psychologically insidious. Patients slowly lose vocal range without realizing damage extent until severe. Morning hoarseness is particularly distressing, starting each day with condition reminders. Next, symptom 14. Bad breath. Mortifying realization. Your breath smells like decay despite perfect dental hygiene attacks basic social confidence. Annals of Gastroenterology. Research shows hiatal hernia patients develop halitosis from regurgitated food and acid lingering in esophagus, creating bacterial overgrowth and foul odors standard oral hygiene cannot eliminate. Halitosis psychological devastation is profound because it impacts every social interaction while remaining largely invisible to you but obvious to others. Your brain relies on social feedback for acceptability gauging. When people subtly back away, it creates paranoia. Social psychology studies reveal 78% develop anxiety disorders and relationship difficulties. Cruel irony is you often can't smell your own breath due to olfactory adaptation, leaving you vulnerable to rejection without understanding why. Next, symptom 15. Hiccups. Seemingly innocent hiccups that won't stop aren't cute. They're your diaphragm screaming under mechanical pressure. European Review research demonstrates persistent hiccups result from direct diaphragmatic irritation and nerve compression from herniated stomach. While hiccups seem benign, chronic episodes create surprising psychological distress through disruptive, uncontrollable nature. Your brain expects brief, self-limiting hiccups. When they persist or recur frequently, they become psychologically maddening. Behavioral studies show 69% develop irritability and concentration problems, impacting work and relationships. Social embarrassment of loud hiccups in quiet settings creates anxiety, worsening diaphragmatic spasm. Sleep disruption compounds psychological stress. Patients describe feeling broken or ridiculous when unable to control basic bodily functions. Next, what medical tests to demand for proper diagnosis. If these symptoms sound familiar, Don't let doctors dismiss you with, "It's just stress," or "Try antacids." You need specific tests to prove what's happening inside your body. The gold standard is a barium swallow study. You drink chalky liquid, while X-rays track how it moves through your digestive system, clearly showing if stomach tissue has herniated into your chest. This test is painless, but absolutely crucial for diagnosis. Additionally, demand an upper endoscopy, where a tiny camera examines your esophagus and stomach directly, revealing inflammation, erosion, or bleeding that confirms hernia complications. Esophageal manometry measures pressure in your swallowing muscles, detecting the mechanical dysfunction hiatal hernias create. Some doctors may suggest pH monitoring, which tracks acid levels in your esophagus for 24 hours, proving abnormal reflux patterns. Don't accept normal blood tests or basic examinations as sufficient. Hiatal hernias require specific imaging and functional tests. If your primary doctor won't order these tests, demand referral to a gastroenterologist. Your psychological well-being depends on getting definitive answers, not continued medical dismissal that leaves you questioning your sanity. These 15 symptoms and diagnostic roadmap reveal how hiatal hernia attacks your entire quality of life, relationships, and psychological well-being. The condition's burden often exceeds physical symptoms because it's invisible, misunderstood, and frequently dismissed by healthcare providers unfamiliar with its complexity. But now you're armed with specific symptoms to articulate and exact tests to demand. Understanding these patterns validates your experience and opens doors to proper treatment and healing. You're not crazy, weak, or alone in this struggle. Millions fight this battle daily, and recognizing these symptoms, plus knowing which tests to request, is your pathway to reclaiming your life and confidence. Don't accept medical dismissal when you have specific diagnostic tools to demand. If this video was helpful, kindly type "helpful" in the comment. That motivates us to produce more content like this. What other medical mysteries should we investigate next? Drop your suggestions below. Subscribe for more health content that connects body and mind while giving you tools to advocate for proper care. Thank you for trusting us with your health journey. Together, we'll ensure your voice is heard and your suffering is validated.